And I think ADHD in general is pretty poorly understood. I think there is a huge piece of it missing because right now our diagnosis really was studied with hyperactive young boys.
Right.
So observable behaviors. That doesn't encapsulate so many people that are suffering from ADHD. And I think one of the biggest problems with that is that it doesn't talk about the emotional side of ADHD. And so as a result, because it doesn't talk about those elevations and depressions that come with ADHD, people get misdiagnosed with anxiety and depression and bipolar, especially for like adult females. For a long time, they were completely skipped by criteria.
Right.
These are the people that historically have been put on medications for anxiety, put on medications for depression. By the time I'm seeing them, they've been on 10 antidepressants that have never worked.
Dr. Hamdani, I'm so excited to talk to you today about the topic of ADHD and emotions and sensitivity in your new book, Too Sensitive. So thanks so much for joining me.
Oh, I'm so happy to be here.
Yeah, it's so incredible to have a physician that has been passionate about a topic enough to write a book about it, this is your second book on this topic. And you have so much incredible knowledge around this that I think is kind of a black box for a lot of people still. I mean, I think a lot of times people go and they're seeking help for a lot of different various issues, but then they get slapped this diagnosis of ADHD and get written a prescription. And I see this a lot, right? Do you see this happening?
All the time. If they even get to that point. A lot of times, because it's poorly understood, they're getting misdiagnosed. It's anxiety, it's depression, it's so many different things. But the prescriptions flow readily.
Yeah. And then the unfortunate thing about the prescriptions is, or fortunate, is people do feel a lot better sometimes, and they end up just using them as a crutch for a long time. Almost they feel like it's a permanent solution to their problem, and they really have no pathway to stop taking the meds. And so I think that's another thing I see a lot too, is like, okay, you're on this medication now. What are you going to do? And they're like, oh, I'm just going to stay on it forever.
See, for me, that to some degree, sometimes that doesn't bother me as much. Because if we are talking about true underlying pathology, I think correcting with the right medication, obviously with lifestyle modification and other things, can be life-changing for some people.
Right.
I'm talking about like when people, for whatever reason, are misdiagnosed or given medications that don't actually apply to them. And then those people sometimes, maybe they do feel a little bit better, or maybe, it's given as part of this complicated regimen and they're like, I don't know what part is helping what part.
Yes.
Then it's hard to get off of it, and then it just complicates everything else. So like at the end of the day, it's with medication, if you're going down that road, and I'm very pro-medication for the record. Like I think medications are incredibly useful tools, but we need to know how to use them and how to get off of them. And we need to know all of those things on the front end.
Right. And to your point, it's really important to have the right diagnosis first, right?
Always.
Yeah, exactly. So, before we get started and go down the rabbit hole of this, I'd love to know a little bit about your history and why this became a topic of passion for you.
Yeah. So a little bit of background. I was diagnosed with ADHD in 4th grade, and it was picked up in a time where it wasn't commonly picked up for girls, but I think I presented more like a boy, and I was more hyperactive. I was disruptive, and so it got picked up. It got brought to the attention of my parents. My parents were like, okay, I think we do need to address this. I started on medication, took that, did relatively well, went through my schooling, got into medical school. We went to the same medical school.
We went to the same medical school. We just made that connection today. How incredible. Kansas City, Missouri.
I'm telling you.
A lot of good doctors come out of that program.
I think so. So I went through, got to medical school, and, by some way got through medical school, got through training, became a psychiatrist, really got into my field. Managed ADHD, it was, a tumultuous road in terms of figuring out what the right medication, what the right intervention, what the right behavioral stuff was. But I think finally got into a relative flow. And then 2024, my dad passed after this rapid almost, he had IPF. And so we were dealing with his lung issues and figuring out what was going on. And then just incidentally, 2023, diagnosed with stage 1 lung cancer. And we're like, stage 1, that sucks. But, we'll work with it. We'll figure out, do the treatment plan. After he had done 1 round of chemo, 1 round of radiation, he was like, I don't feel great. We go do a repeat PET scan. It was everywhere. It had seeded to lymph nodes, and he died 13 days later. So I think in that process, and this is a little bit embarrassing for me to say as a psychiatrist, because I feel like I should have my finger on the pulse in terms of my own emotional climate. It was the first time I linked that my emotions directly impact my functional status. So I think when I was looking at it through that lens, the bigger something was emotionally, if I couldn't process what was happening, that's what would tank me. If from an ADHD perspective, if I was overwhelmed or if there was a lot to do, I could hack my way around it. I could delegate. I could find the right people to help me, but I couldn't delegate my emotions. And so when there was something emotionally heavy or something that I needed to process through, that's when it was most difficult for me. And so that kind of got me down this road of looking at just emotional sensitivity as a spectrum and how people process emotions and how it's tied to functioning on a daily and basic level. And then that's where the book came from.
Yeah. So it's almost like taking a step back or a 10,000-foot view on a diagnosis like ADHD and seeing how does just the overall emotional state of the person affect their, I guess, how much are suffering from this or how much or how you even treat it.
Impactful, yeah.
Yeah.
I think ADHD in general is pretty poorly understood. I think there is a huge piece of it missing because right now our diagnosis really was studied with hyperactive young boys.
Right.
So observable behaviors. ADHD, that doesn't encapsulate so many people that are suffering from ADHD. And I think one of the biggest problems with that is that it doesn't talk about the emotional side of ADHD. And so as a result, because it doesn't talk about those elevations and depressions that come with ADHD, people get misdiagnosed with anxiety and depression and bipolar. And so especially for like a subsect or a population like adult females, for a long time they were completely skipped by criteria.
Right.
These are the people that historically have been put on medications for anxiety, put on medications for depression. By the time I'm seeing them, they've been on 10 antidepressants that have never worked. So I think being able to look at ADHD more comprehensively, look at that emotional component of ADHD, and then understand, okay, medication aside, getting the right diagnosis important, but what are the tools that you can use to manage that emotional side of things? Because I think for a lot of people, you've been told every time something emotional happens, like, take a deep breath, do this. And it's really more about, the advice might be sound, but it's how do I apply it? When do I apply it? And how can I do that and start practicing it when I'm not in a dysregulated state so I can use it when I need it?
Right. That makes so much sense. So, for the people that are listening to this, I think a lot of people wonder because they've heard from friends that they're on medications for ADHD, if they have ADHD or not, right? And to your point, a lot of times when you're going through very emotional situations, you might either get mixed diagnosed with having ADHD or not get the right diagnosis. So when you see a patient that is coming to you and says, I think I might have ADHD, how do you think through that diagnosis? And like, what are the key indicators to you that you should be thinking about ADHD as a diagnosis?
So there are two things that are happening. When you look at ADHD, one part is truly ruling in the ADHD. Is this ADHD? And I think that's looking at everything because I think at its base, ADHD is a dysregulation issue. So it's not just attention, but you have to look at attention and energy and motivation and all of these multifactorial pieces. The second part, which I think is equally important, and that's why it takes a skilled provider to find out what it is ruling out everything else. I want to make sure that this isn't anxiety. I want to make sure this wasn't trauma. I want to make sure this wasn't depression. I want to make sure it's nothing medical. I want to make sure this isn't a thyroid disorder or like underlying metabolic difficulties or anything like that. So I think that there's two parts of it. It's ruling it in and ruling out other things.
Got it. And so by ruling it in, and you described this as a dysregulation, what's going on biochemically or in the brain that creates attention deficit disorder?
So there, again, this is something that I think deserves so much more data and
Right.
research not just in the scope of what our criteria is now, just
Uh-huh.
focusing on the attention part of it, but looking at everything comprehensively. But I think a lot of when you look at ADHD, you're looking at neuroanatomical differences,
Uh-huh.
and you're also looking at underlying wiring and neurotransmitter
Uh-huh.
imbalances.
Yep.
And not necessarily, a lot of people think, when we talk about dopamine imbalances and things like that, a lot of people are like, I don't have dopamine in my brain, or I'm missing dopamine. It could be that the amount of dopamine you have is totally fine. It's just in the wrong place at the wrong time.
Uh-huh.
So when you look at from the anatomical side, like just from a very basic level, the emotional areas of the brain, so like that amygdala, that threat
Uh-huh.
detector in the brain, are a little bit more hyperresponsive.
Uh-huh.
And the frontal lobe, in charge of decision making and processing, tends to be a little bit under responsive.
Uh-huh.
And that connection between the two is weak. So now you have this heavy emotional center that's taking in all of the stimuli that's coming in and processing it in real time. And you're getting triggered emotionally and processing. And then your frontal lobe is maybe a little bit laggy to catch up. So now you're processing all of the stuff with this emotional overlay on top of it, which makes it insane that we haven't included that in the criteria.
Right. Right. I think, for a lot of people that understanding this emotional component to ADHD could become something completely new that they've
Totally.
never heard about.
Yeah.
And so it's really important that you've highlighted that and and we're going to talk about the tools here in a little bit. But for the person out there that is listening, like you guys have diagnostic criteria for ADHD.
Yeah.
Are there like online questionnaires or standardized questionnaires that people can do to understand if they're at risk for ADHD or if they should see someone to get diagnosed with it? Or is the best way to really know to see a psychiatrist or a psychologist and get a diagnosis?
I truly believe that the best way to know
Mm-hmm.
is go to a mental health professional. Not because I think the ruling in ADHD might not be so hard. Like, I think because of where criteria stands right now, it's asking very observable things that you might be able to recognize in yourself. Like problems with disorganization, problems with forgetfulness, difficulty initiating tasks. Can you stay in your seat? Are you fidgety? Do you interrupt? Like all of these things, for the most part, people have a pretty good gauge on. My issue with those criteria is that, number one, misses a lot of other things. And number two, you could be getting those things from other stuff. You could
Right.
be anxious. You could be depressed. You could have hypothyroidism or hyperthyroidism. So it's important to, yes, like if I've had patients come to me and they're like, I did this online, I have ADHD. I was like, nope, that doesn't mean you have ADHD.
Yeah.
It's you've talked about symptomology, but you need to understand like the actual longitudinal nature and the patterns and all of these other things. And you need to be able to rule things out. And that's what's not discussed in those online surveys.
Yeah, that's absolutely true. And, coming from my functional medicine perspective, like you've mentioned thyroid and other disorders at the same time, like I think anyone with any type of mental health diagnosis should undergo a full functional panel looking at their hormones, looking at the state of their metabolic health, and really doing a deep dive on other things that could be going on beyond what's just going on in their head, right? And so,
I think it's really important to understand the underlying medical picture when you're
right.
looking at mental health. For sure.
Yeah.
For sure. Because I think it's going to be, number one, really important for figuring out exactly diagnostically what's going on. Are we treating the wrong thing? Number two, from like just a logistical medication perspective, it's all going to be impacting other things as well. So you really need to know what's my baseline, what levers can I pull to get the right management.
Right, right. And if anything, treating the underlying physiological problems, the underlying physical diseases will just make the treatment of the mental health issue much easier, right?
For sure.
Right? I mean,
For
definitely
sure.
they have to occur hand in hand. So, okay, so I've had a few people on here talk about EEG, and this is like a really hot topic now is EEG and doing brain mapping on people using the electrical signals of the brain. And obviously, like this is done in for the purpose of trying to delineate, like, is this really ADHD versus depression versus something else? How do you feel about EEG and using that as a modality to help with the diagnosis?
I don't know. I don't think the data is there right now. So I don't think I can lean on that and say, like, this is going to give me a significant, it might give me data, but it's not right as of where it stands right now. It's not going to give me data. Is this ADHD? Is this not?
Right.
And so that's where I kind of like when you look at, some of these, looking at really expensive scans, looking at really expensive, like neurological interventions and things like that. Sometimes I'm like, let's just go back to basics. Let's figure out what's happening medically. Let's figure out what's happening psychiatrically, and then kind of put together those pieces.
So to your point, I mean, the real diagnosis should occur with a mental health professional that's also taking into account your physical symptoms and doing blood work to kind of see what's going on in the rest of your body at the same
That's
time.
typically why I lean on, and it's not a hard and fast rule, but I really do like getting that diagnosis through psychiatrists because they've had that medical school training, because they've had the psychiatry residency. But I will admit to this, access to care is a huge problem. Like this is not, I can say these things, but getting to a psychiatrist is difficult. Getting to even a primary care doctor can be really difficult. So I tell people, when you're exploring ADHD diagnostically and trying to figure out information, if a doctor isn't available to you, just make sure you're getting information from the right places. I think that's really important. Like when you go online, there's such an incredible onslaught of information, especially about ADHD, and some of it is good and some of it is so bad. And so it's finding out what information and what clinical pieces you can actually trust and put together so you can understand your own internal environment better.
Yeah, absolutely. So when you're looking at some of the tools that people can use regarding their emotions and emotional dysregulation that you've probably written in the book, I'd love to kind of hear how do you explain it in the book, and like what do you tell people to, first of all, like when they're looking at the mirror at themselves and they're trying to figure out how to manage their symptoms, how do you tell them to kind of approach it?
Number one starts from understanding yourself, your patterns. And I think that that's a really interesting phenomenon because I don't think many people have thought about this emotional side of it. They think about ADHD. And I've been guilty of this too, because even when I was in medical school, I was like, I know what it means to be ADHD. It's like you're really hyper and you're all over the place and I don't think that's how I'm presenting right now. And so I think it was just difficult for me to actually understand that diagnosis and see myself in it. But I think with this book, with Too Sensitive, the way that it starts, so the first chapters are truly about the neurobiology, like how your brain is wired, because I feel like that's the best spot for understanding. You'll know, you agree. But then it moves into the emotional sensitivity spectrum, because I think part of the issue is there wasn't a lot of verbiage of what's normal and what's not. Like what's too sensitive, what's not sensitive enough. So if you're looking at it on a spectrum and you'd put like the middle as situationally appropriate, you're elevating and depreciating based on what's happening. And then you look at one side and you're looking at apathy, where it's, emotional things are happening, but I'm not really moving one way or the other. I'm kind of numb. And then you look at the other end of the spectrum, where I live, and it's just, you feel emotions very robustly. You feel things quickly and deeply and for a long time. And so I think when you figure out where you fall on that spectrum, then you actually start looking at like, okay, I'm neurologically processing this differently. In which case, if I am processing things very deeply, very quickly, what tools can I use in that moment to help me get through that? Because I don't necessarily want to make you less sensitive.
Right.
I want to just give you more control.
Yeah.
Yeah.
Yeah, that makes a lot of sense. And so when someone, let's talk about both sides of the spectrum, right? Okay,
Yes.
so someone is really in this apathy mode where they're just not experiencing or they're suppressing emotions. How do you discuss the tools with that type of person?
Well, first we have to figure out where is that coming from, right? Because I think with apathy, it's a little bit different than the other end of that kind of a highly emotionally sensitive spectrum. For people who I feel move into that apathy, Is it depression? Is it an underlying medical thing? Is it burnout? Is it sleep? Like, where is this coming from? Because I think once you get into a spot where you move someone from feeling that numbness, the natural pendulum kind of moves more into the median most of the time. And so trying to address that with, is there some underlying functional reason for this? Now, there's some people who just don't elevate or depreciate much. They don't swing much one way or the other. And so, for those people, then it depends on like, how dysfunctional is this to your life? Is this impacting you? Because if you're fine with that, if emotions don't go up or down, but you're like, that's just my baseline, we don't need to correct anything at all. I feel like on the other end of the spectrum, I feel like those are the people that are intensely disrupted by their emotions. And usually those are the ones that the emotions can feel so big and overwhelming and scary that they drown in that moment. And so the tools, which are all, by the way, tools you have heard of over and over again, it's really just how to apply them, how to use them, how to practice them. And then the step further is the latter half of the book is actually real world examples where it actually walks you through like, this is happening, this is how to solve it in real time. So I think with people on that end of the spectrum, I think it is such a useful exploration of how to manage these kind of difficult feelings and emotions to give you a little bit more agency.
Yeah. I think, the people on that side of the spectrum that have, can we call that emotional dysregulation?
Yeah, I would say highly emotionally sensitive, but
Highly emotionally sensitive. Okay, got it. They seem to be kind of always kind of living on the edge of having another breakdown of some kind, whether it be crying or just
emotions are like right here.
Yes, right here, ready to break down. How does someone like recognize when they're getting really close to that breakdown moment?
We know.
You just know.
No, it's not even like for example, with me, I'm acutely aware when I'm kind of in that. If something is, I'll give you an example that happened last week. Yes, last week, with this press tour for the book. And it's like a very weird concept to write a book about emotional sensitivity and then have to do press. Like, it's just bizarre. But, you'll get these kind of things where, you're slated to appear on a podcast and then last minute they'll cancel. And so in my brain, what my brain is telling me is they canceled because you're too small of a fish, or they canceled because they saw something that they didn't like, or you're not, what you wrote about is not important enough for them to deal with. Spin, 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 spin. And then emotions are up here. I feel all that. And so it's a matter of, I know that I'm doing this. I know that, but that's just my nervous system is dumping alarm chemicals telling me that something dangerous is happening. This is what I'm dealing with. And so it really becomes, how do I regulate my way out of that moment?
Yes.
Because I think I'm still going to be acutely triggered. It's getting less, but because I'm tired, man.
Yeah,
but like,
right.
But I think that I'm still I feel like when I'm 80, I feel like things impact me significantly from an emotional side. But the thing that I like about this book is that it's like, okay, well, here's how we work through this moment. This sounds like me. This sounds like what I'm going through. Here are the steps.
So that was a perfect example. So, and that's good to know, because I think what you're saying is you're going to spin and it's going to happen. It's going to be dependent if you're on a book tour or if you have like a difficult conversation with a boss or something, it's going to happen. And the goal is not to become like a stoic person or someone who has very little emotional
depth.
volatility or death, right? Volatility or depth. No, what am I trying to say? Depth.
Yeah.
I'm going to say that again. The goal is not to become someone who is not having emotional volatility or depth. It's really to recognize when that's happening and then implement some of the tools you're talking about.
Totally.
Right. Okay. So let's talk about some of these tools, because I feel like this is a great conversation, whether you have ADHD or not, right?
I know. This book
anyone
is not,
can use this.
Yeah.
Right?
It's not written just for people with ADHD. A lot of the research stems from that because it is so common. But this is, I feel, I haven't had a conversation with a person who either doesn't identify with that themselves or doesn't have someone in their direct circle that they feel it doesn't apply to. So I think that everyone is touched by this to some degree. But what I would say is when I was going through this in research for this book, trying to figure out what are the tools that can help in the moment and over time to help you build that emotional resilience, it all fell back on tried and true things that, things like challenging negative thoughts and mindfulness in the moment and delaying reaction and moving your body. These are all things you've heard 1,000 times, especially if you are an emotionally sensitive people and people are like, you're blowing this out of proportion. This is not a big deal. And the next words out of their mouth is like, just go take a walk. You'll forget about it. So some of that advice might be sound, but I hate it. Don't tell me that because that's not helping me. But knowing neurologically what is happening in my brain in that moment, this is how I'm feeling it. This amygdala is literally on fire. My frontal lobe isn't kicked on. How do I chase that balance a little bit better? And so seeing how you feel and appreciate it in the moment. Like there are times, like with this book tour example, it wasn't that I was just calm and, sitting down and like my brain was spinning. I was anxious and pacing. And my husband was on the other end of the couch and he was like, easy. Like, what is that? Like, what was just in your phone that made you jump up and I was just very restless because I was just building up this emotional response. And I knew in that moment that if you had told me, just take a deep breath, I would have punched you in the face. Like, I'm not going to do that. I can't do that right now. But then I thought, and I was like, okay, I know I'm spinning up. I feel my emotions right on the surface. I'm feeling this with intensity across my body. I need to move. I need to get out this anxious energy. I need to give my body a chance to push that oxygenated glucose to my frontal lobe so that can kick on. And so I just started doing, I had seen on a podcast like 2 hours earlier how important, doing squats were good in terms of, and so I'm like standing there and like I'd gone from like pacing all over the place to like just doing squats. And my husband was like, what's happening? But I'll tell you, within 2 minutes, I was like, okay, all right. We're you can feel that kind of alarm response calm down a little bit. And then I was able to actually tell him what's going on and hear what he was saying in a way that I wasn't like, no, that's not it. So it truly does help in that moment, but you have to understand what's happening in your body and you have to know what skills to apply and when to apply them.
Yeah, no, it's so true. So, part of what you're saying is just recognizing that this is happening and then also having the wherewithal to recognize like this is a physiological process that's happening, right? So because it's a physiological process, physiological solutions exist like moving your body, doing squats, getting the blood flow going, right? And so I think that's a really important point to make is like people aren't just telling you to go for a walk because they want to avoid you. It's actually a treatment for this is moving your body.
It can be. I just don't want someone else to tell me to do that.
Right. Exactly. You got to tell yourself to do it.
I got to tell myself. I'll figure it out on my own.
Right. Okay. So what are some of the other things that people can do?
So the tools that I had, I narrowed it down to 12 because I felt like there were the most impactful and the best data behind them. Because it's important to like categorize it based on like what actually has data behind it.
Right.
So in that, yes, there's the movement, there's challenging negative thoughts. One of my absolute favorites, which sounds so dumb, and I recognize that, is delaying your response. Because that has never occurred to me. But, when you get a text message that may be giving you bad information or they're writing something that's making you acutely anxious in that moment, my initial response is to follow up immediately, send a bazillion texts of clarification. I want to know emotional tone behind this because I'm not appreciating that from the text message. I want to know what your thought process is. I want to know how this affects our relationship going forward. I want to alleviate my own anxiety. I need to resolve this potential conflict I've built up in my head immediately. I feel like it took me a long time to understand if I am able to pull myself out of that moment and purposefully delay that immediate, almost muscle memory response, I can give my amygdala time to calm down. I can give my frontal lobe time to kick in. And then my response is so much more measured. Sometimes I go back to the phone. I'm like, I truly don't need to respond to that. It's just information they're giving me. Or I see what I have typed out and I'm like, that's insane. I can't send that to a human being. And so it just allows you to pull away from the moment. But that is such a skill. That's something that initially feels really weird and feels like I can't do that in this moment. But if you're able to practice it in times where it's lower stakes, it becomes, you start to see this actually does help me. So that when it's a higher stakes moment, you're like, okay, I know what to do now. So I think these kind of things, applying it in moments where like it's not life or death in your brain, really helps you build those skills and helps push you more towards that true emotional intelligence and resilience.
Yeah. Yeah. I think about like, you know, back when there was no text messaging, it was emails, and you were always told like sleep on it, send the email the next day. Now
Yeah,
it's like everything is so instantaneous with phones and text messaging that you can, whip out a response immediately, probably when you're in the worst state of mind sometimes.
totally.
And so it's the more distance you can have from your phone, the better, especially when these kind of messages come through that do initiate an emotional response.
Burn it, start it over, throw my phone into the sun.
I
I
know,
know. I
right?
just like, and I feel like I have an 8-year-old girl and she
Mm,
sees me on my phone doing social media or things like that. And she's like, Mom, when can I have a phone? And I was like, I hate my phone.
yeah, I say the same
I
thing.
hate my phone. There's nothing good in there.
I say the same
So
thing.
it's phones are just like a hotbed. My feelings get hurt all the time in there.
Yeah, yeah, it does. Not a lot of good stuff comes to the phone. Exactly.
Ugh.
Whether it's social media, text
It's
messages,
all
all of it.
bad.
Right. Exactly. And then, that also brings up another point. Like, we were talking a little bit earlier about children and kids. And I also have a 9-year-old. And obviously they're all asking for phones, right?
Yes.
And they all already have some sort of device, whether it be an iPad or a computer. And I worry about these children developing more anxiety and more attention deficit
Yeah.
with the amount of immediate responses they have to have in everything that they're doing on that device, right? Whether it be a game, messaging, etc. And, my kids, sometimes they have two devices open at the same
I
time,
know.
right?
It's a whole thing.
Yeah, exactly. So, what does the research show around exposure to devices and developing anxiety or attention deficit? Is this a real problem, and what can we do to mitigate some of this?
So first and foremost,
Mm,
devices don't cause ADHD. So
mm,
like I get this question all the time. Like, I've been on TikTok for so long. Like, I gave myself ADHD. I'm like, no, you didn't. Like, it can exacerbate an underlying
mm,
problem for sure. And I think, and this is like a hot take because I am on social media,
mm.
makes it feel very hypocritical. But I do think overwhelmingly, just this like incredible rate of consumption of like short form like
Yeah,
like the difference between TikTok and Instagram versus YouTube. I mean, although YouTube has shorts, but this the way that people get into this almost like dopamine loop of
yeah.
scrolling, things like that. And the way that, I mean, have you seen some of those like even TV shows and games for kids right now? It is so stimulating.
Right,
It's not like
right.
like when we were younger, it was just
No.
like you wouldn't like these cartoons were like Garfield and
Like Tom
like
and Jerry,
Tom
yeah.
and
Yeah,
Jerry.
like things
Like
would take forever to materialize and happen. And now it's like it almost seems like a drug trip watching some of these cartoons for kids.
it's insane.
Yeah.
And like some of it is frankly like drivel. I'm like, who
Mm,
did this? Who approved this? And it's just like this rapid content. I'm like, this has no message.
yeah.
This is crazy. I don't like I hated this so much. Like I've sat in on some of these shows and I'm like,
But, I'll tell you, like I watch some of these shows with my kids sometimes. Like this is one called The Wonderful World of Gumball. Have you seen this?
no.
Oh my God, don't subject yourself to it. It's
Oh,
crazy.
okay. I thought you were going to tell me
Yeah.
something good. Okay,
No,
no.
no, no, no. It is exactly that. It is like no message, just craziness happening constantly,
Just
lots of visual. And I can see how these kids get like they get completely addicted to like everything is built now to create a dopamine loop, to your point,
for
right?
sure. I mean, my kids will watch TV and I'm like, blink, blink.
I know.
You have to blink. You have to do all these like, and the thing is like, there are no commercials.
Yeah.
There's
Right.
no break in that.
Right.
And there's no ending. Like if I wanted to watch a show, okay, like 2 seconds later is Dateline. So I have to go like my parents are gonna watch that. I don't have the TV. Like
Yeah.
you'd get a break in content just because of the scheduling on the TV and
Yes.
fighting for
Yes.
channels. There is no
There's no
like
break.
there's no break. You
Yeah.
could watch till you were 25 years old and you would have no break and my kids would love that.
Mm.
But it is one of those things where I'm like it's important enough that I do think that this constant hyper stimulating media does fragment focus
Mm.
for sure. I don't think it gives you ADHD, but if you have an underlying ADHD, it can make it much worse.
Uh-huh.
I think that I think it can make anxiety worse. I think
Uh-huh.
so. What I tell people is I'm not anti-TV. We use TV all the time
Yep.
in our house, but it's one of those things where it has to be balanced with other things because I can't just and I'm saying I can't just let my kids watch TV all day because they're like uh, they're emotionally fragile after that.
Yeah.
It's like they don't eat, they don't blink, they don't do like
Right.
we need you to integrate with the human world for a
Right.
little bit.
Right.
And they don't
Yeah,
like that.
I definitely think, there needs to be time limits, especially the way the content is now. That is much less than what it was when we were kids or when I was a kid. You could watch TV for 2 or 3 hours and not get overstimulated because it was
No,
like boring content a lot of times. But now every piece of content just creates so much massive stimulation. And to your point, like they are very emotionally dysregulated after.
totally.
y-
Especially in that transition to pull away. I'm
Yes.
like, why are we having a tantrum
Right.
now?
Right. Exactly. And is the only solution then is just time limitations?
Time limitations and then other stuff.
Yeah.
Like doing other things to kind of counterbalance, like go touch some grass, go play
Yeah.
a game. Let's go and do like one thing that we started doing is like evenings were really hard because they were tired from the day. And we're trying to do dinner and wrap up things and get ready for the next day. So it's a tough time
It
in our
is.
house.
Yep.
And that's a really easy time that I found myself being like, okay, just watch TV. It's easier. But then like just even trying to pull them away from that. I was like, I can't have a tantrum before bedtime every single day.
Right.
And so we go on this family bike ride around that time. And bike riding, because you were in Kansas City, trying to bike ride in July and August in Kansas City is like a suicide mission. It is so difficult and hot
Yes, hot and
and
humid.
wet.
Yeah.
Yeah. So but it's something that we can do as a family that doesn't require screens.
Yes, give another option. Yeah, we try to go for a walk after dinner now, and just that way it avoids the screen time. Is there a tool in the book that kids could use when parents are noticing them getting emotionally dysregulated? What is something that you can do with your kids? Like you mentioned a bike ride, so that's getting physical. What's another tool that works well with kids?
So part of this book, and this is coming from someone who is emotionally sensitive, who
Mm,
has an emotionally sensitive child. It's interesting because so many skills of how to deal with an emotionally sensitive child require you to be an emotionally
mm,
preserved place to be able to provide modeling for them. And I felt like it was increasingly difficult for me to manage his sensitivity while working or while being in such an emotionally dysregulated state myself, especially
mm,
around my dad passing. It was so hard for me to parent.
mm,
And so I think all of these, every single one of these,
mm.
is a useful thing that the more you practice, the more you can also use with your children. Because I think they're all skills that you've heard, that you've used, that you have told your kid probably to use. But knowing how do I apply this? When do I apply it? And in our house, not that we're the gold standard. Our house is a whole thing most of the time. But I think, especially with my dad's stuff, I couldn't shut off that kind of emotional tap.
Yeah.
I felt things deeply. It was hard for me to get through that moment. And I think even when my kids were really little, also giving them to space, showing them like, Mom is sad right now. How do we work past that? Mom is anxious right now. Can you tell me a skill that could help me? Let's work on this together. So showing them that, yes, it's fine. It's safe to have emotions. That is something that is part of the human experience. But how do we work through this? I think is really useful. So having your kids see as you're navigating this is also a huge, huge benefit.
Yeah, that's so true. As well, they learn so much from their parents,
Yeah.
and understanding what your parent is doing can sometimes, they learn from seeing, not what you tell them.
Oh, yeah.
So if they see you do something to regulate your own emotions, they'll mimic it.
I know. And that's why, like, we've really tried to minimize, like, even on planes are so hard for us
Yeah.
because it's just, number one, it's so boring. But number two, it's just like, all you have your phone, and
Yeah.
that's where, like, my emails live. So I'm like trying to do work. They don't see that. They just see me being on a screen.
Absolutely. Yeah.
And so we've tried to, like, bring books with us and do that. And so it's a work in progress. So if
Yeah.
you see me on a plane and I'm scrolling,
I'm going to buy you a book.
yeah, buy me a book.
Absolutely. Let's talk about anxiety real quick. Can you talk
Yeah.
a little bit about the science of what people are experiencing when they have anxiety? And
Yeah.
are there tools that can help also from your book with people that are getting close to feeling like they're going to have that anxiety attack?
For sure.
Yeah.
I think that with emotional sensitivity, once you feel something so robustly, you're really fighting off that neurological onslaught of all of these alarm chemicals mounting up that look like anxiety. That is the same, we're working on the same mechanisms that trigger anxiety.
Right.
So when you are dealing with those big responses, big anxious feelings, these tools can help because they calm down the same areas. With anxiety, you're still looking at that amygdala, that threat response telling you there's something to be anxious about. You're in trouble. This is a problem. You're in danger. That's all happening in real time. And that frontal lobe that's supposed to calm you down, nowhere to be found. Like, where are you?
Right.
And so this is so nice in terms of what can I do in this moment? Because like the most incredible thing about the brain is that you have the capacity to rewire it. You have the capacity to make things and enhance things and make them better, which I think is such an incredible thing about psychiatry and about neurology and about actually about all of medicine,
Right.
that you're able to have this impact on, I know that this is how I feel and these thoughts are very automatic, but with practice and with working on this, there is going to be a time where they won't feel as automatic and as urgent. And I think that's incredible. And that makes psychiatry to me so hopeful.
Right. Yeah. Because you can make changes.
Yeah.
And to your point, like the brain is so neuroplastic, meaning that if you're making changes on a consistent basis and doing it like daily and getting to habits and routines, these changes will become more automatic and therefore one day even more permanent.
Yes.
Yeah.
Yeah.
You mentioned the frontal lobe a few times.
Yeah.
And I think one of the things that you talk about is executive function, right?
Yes.
So how can people improve their executive function and their frontal lobe?
So executive function are basically the set of skills that are goal directed. So moving your brain, if you want to get from point A to point B, what are the steps I need to take? What's the planning? What's the execution of these steps? So when you're looking at executive function, there's definitely steps in terms of how can I enhance my focus for this? How can I increase my motivation for this? How am I going to allocate energy for this? And then the other big part is like, what's my emotional state? Is that going to allow me to do that task and to figure out and plan out what I need to do? So I think when you are looking at all of those multifactorial pieces of executive function and how to get from point A to point B, you can enhance that, but you have to kind of figure out, what do I need to work on in that moment? So if you're working on it from the emotional side, use these tools, like learn to kind of manage your emotional climate. And I know that's not easy. That's something that I actively am working on. But like being able to grab hold of something and be like, okay, let me try to work through this and reduce that activation so I can get through. Because I think if you can manage the emotional side of it, a lot of times you can get those things done. If it is an energy component, like I simply don't have the energy for this, go to sleep.
Yeah.
Like, I mean, unfortunately, that's one of those things. A lot of people are like, I can take caffeine, I can drink, I can have an energy drink, and those don't actually give you energy, right? They're just fighting off your sleepiness cues. The thing that gives you energy is truly that restorative sleep and letting your body kind of restart. So I think, and if you're looking at motivation, you have to look like, what's it about this goal? Is it overwhelming? Is it that you don't truly have that drive to get there because of, whatever conflict that you have about it? Is it that, just those initiation steps are too difficult? Like, what is it that we don't have a good entry point into it? So you have to kind of figure out what part of it is making the task difficult and then go from there.
Yeah, that's a really good point. I also try if I have an overwhelming goal, is to try to break it down into components, right?
Sure.
Just what are the first steps I need to take, the most baby steps I can do in order to make some progress towards it, and that helps to reduce the anxiety around it. Also, I think helps just the thought process of like to your point, like improving executive function. There are ways to get into a habit of breaking down your goals into smaller pieces that are achievable, that then rewires your brain into thinking that goals are achievable in general.
I can do this. And there is a certain, like, that initiation hump, just gaining momentum after that. Things start to click and pace because you've already kind of gotten a little bit of a release of dopamine. Your brain's working a little bit better. Then you do the next little step. Your brain works a little bit better. Then you just keep going from there.
Yeah. It's so powerful to know and understand that your brain can be rewired, and with doing things again and again, that these rewirings can become more permanent. Neuroplasticity is so powerful.
It's so powerful, and it's so amazing as a concept, because I think what leads to a lot of this hopelessness is that people are like, I have this, I was born this way, and this is how I'm going to stay. And so it's just an incredible concept that, I think is so hopeful that we do have the capacity to change our brains.
Yeah, that's so awesome. Well, I'm so excited to read your book, and I can't wait to read it. And this was a great kind of intro, a little taste of what you have to write about. And I can't wait to read about all 12 of these tools and start using them in my own life. So I really appreciate you coming on the podcast. Thank you so much for doing this. Before I let you go, for someone that wants to get started down the journey of managing ADHD, anxiety, or just emotional regulation in general, other than reading your book, what are the top 3 things that they can do?
Oh my gosh. Know your patterns. Know your patterns. That's huge. Because a lot of times I feel like people get into these situations where they're trying to solve problems, and every day feels like they're reinventing the wheel. Because they're isolating little things. Once you kind of look at what are my patterns, then you start to understand what are the holes, and then you understand how to fix them. So I think that's the first thing. Second thing, sleep. Sleep. You should be sleeping. And that's something that is, I find sleep super boring, and I'm very bad at it. So I think it has taken a lot of discipline and focus to get to a spot where I'm like, this is so important for my brain to function and for me to process and for me to deal with kind of emotional sensitivity in the first place. Huge.
Yep.
Last thing I think, and these aren't in a specific order, but the last thing I think is just like overall, look at your body as a whole. So like once you understand, and like just looking at your brain and your body separately, and like this is good for my brain, but you might be doing something a little bit counterintuitive for your body, looking at something for your body which might be counterintuitive. Look at all of it. This is all part of your body. So I think that's the problem a lot of people get into. It's just they treat the brain and they forget about the body. They treat the body, they forget about the brain. All of it should be together.
Absolutely. That's such a great point. Thank you so much, Dr. Thank you so much, Dr. Hamdani. It's such a pleasure having you. Can't wait to have you back on your next book. Where can people learn more from you, and how do they get the book?
So you can find me on all of the socials. So I'm on Instagram, I'm on TikTok, I'm on YouTube, and my name is the Psych Doctor MD.
Okay.
And the book is out on August 25th, which I think is around when this will release. So, and you can get it anywhere books are sold.
I love it. Thank you so much for joining me today.
Thank you so much for having me.